Hi folks, thanks for all your questions. Sometimes you Facebook them, sometimes you go to the website, sometimes you're messaging me, which is all fine. So however you want to do it works out. I have a handful of questions, but one main one. So I'll read these other questions. Do you believe in an alternate vaccination schedule? No. Do you believe the Gardasil shot encourages children to have sex at an earlier age? No. How tall are you? I'm 6'3" with my wife's high heels on, because I measured myself. So you do the math from there. What are your credentials? Which is a good question, because I guess I don't have any credentials posted on this Facebook page. I have them on the website. So I can put them at the beginning of this video. No, I'll just put them at the end, because that way you don't have to suffer through reading all that unless you really want to. So I'll put that at the end. Okay, and then the question is for today, is it necessary to examine my child's genital area for their checkup? It seems very traumatic. It's traumatic for me to get examined by a professional. I mean, that's my job. That's what I do. That's what I was trained in. But when I go in to see the health professional or the doctor or the PA and NP, I don't like people looking at me naked. It's weird. And I don't like people touching me, in my sensitive areas. In an exam room, it's a weird experience. So I think that the best thing for you first is at home to prepare your child and tell them, we're going in for checkups just to make sure everything's fine. The doctor or the PA or the NP is going to examine your total body. They're not going to skip any parts, because they want to make sure your whole body is healthy, and that includes even your private area, your penis, your testicles, your vagina, and whatever you refer to their area as, so they know what you're talking about. And you tell them, I'm going to be there the whole time. He's not going to hurt you, but if anything happens, you get scared, then we're just going to stop, and we're not going to do it anymore. And then you prepare your child for that. And then when you come in, then it's my job to talk to the child, and I'll say to him or her, okay, I can't touch you. I cannot put my hands on you. I'm a doctor, yes. I'm an adult, but just because I am bigger than you, I can't just put my hands on you. I have to ask your parent for permission to even touch your body. I have no right to do that. And then I turn to the parent and I say, Mom or Dad, can I have permission to examine your daughter, your son, Billy, Sally, Jenny, whatever? And then the parent says, in front of the child, yes, you have permission. And then I say, okay, thank you for permission, but even though I have permission, you as a parent have to stay here and watch me to make sure that your child is protected at all times. To make sure the child hears that, because they have to know that just because I'm in a position of authority, I don't have the right to put my hands on them. And they have to know that their parent will always be there to protect them if someone tries to put their hands on them. So I guess the last stage is that the exam should be a very patient and gentle exam. It shouldn't be forced. Your child should never be held down to have their genitalia examined. I think that's a very traumatic thing, and I would agree with that. That can be traumatic, especially for girls. You have a man and the little girl's being held down while the man doctor examines their private area. I think that's absolutely wrong. If it comes to that point that you're holding your child down for someone to examine their private area, I think that you need to stop and try again another time, because that's not putting a good impression or a good memory in that child's brain. So that's it. So I'll post the credentials at the end, and you can message this button here if you'd like to send a question directly, but you can send it however you want. But the questions are good, and I appreciate them, and I hope you all have a great week. Thank you.